With over 30 years of experience, chiropractor Dr. Becker has mastered the art and science behind treating a range of chronic pain conditions with really remarkably quick results. And he's joining us now. Welcome, Dr. Becker.
Thanks for having me.
All right, doctor, so tell us, what is it that actually causes tailbone injury?
Well, I think the greatest thing, or the largest percentage of tailbone injuries are usually slips and falls. People slipping on the ice or, on a stair, that type of thing. The second largest percentage probably is people who are sitting improperly, leaning back on that tailbone, sitting too long or sitting on a hard surface, that type of thing.
Okay, so then what is it that can be done for people who injure their tailbone, let's say, on like a slip and fall?
Well, I think there are short-term remedies and then the longer term. The short-term remedies, something like sitting on a donut pillow, trying to change your posture, warm baths, taking aspirin, doing yoga, or stretching. Those are the short-term things.
Right.
But once that tailbone has kind of shifted, you really need to go in and have an internal manipulation of the tailbone to try to move that joint. I think of it as a bit of a door hinge. If it's squeaking and moving improperly, you want to just kind of move it and set it right so that it moves smoothly.
That makes sense. So how is it then that people can actually prevent back and tailbone pain?
So I think that obviously there's no preventing the accidents, but in terms of the other injuries, preventing it would be having good posture, sitting in a relatively good chair, especially if you're going to be there for hours on end, but also kind of having general good posture, good muscle strength, exercising regularly. That's going to keep you strong and hold your spine up and give you that kind of relief that you need.
Okay, let me just sit up straight. There we go. Okay. So do you have any sleeping tips that can maybe help our backs?
Well, I think if you've been sleeping in a certain position for, a few decades, you certainly don't want to kind of stir things up too much. I like to kind of, if that's your comfortable posture position, I wouldn't recommend that you change things because an expert told you that, you should be sleeping on your back. You sleep how you sleep to be the most comfortable. But if you are having a problem, certainly there are things you can do, whether it's, trying to, put a pillow under your knees to give your lower back some relief. But basically, that's also the same as almost kind of sleeping in a fetal position. So kind of flexing your back, flexing your hips, flexing your knees takes a little strain off the low back. If that helps you for a few days, great. I would certainly, though, go back to your regular position. And again, I like people to kind of keep the posture and positions they're accustomed to.
Awesome. Well, thank you so much, Dr. Becker. This was super informative.
Thanks for having me.
Thank you.